You know, I think one of the most common questions that I hear from people who are newly diagnosed is, what can I do? What can I do to help myself get better? And the good news is that through much of the research that we've done over the years at Catch, we've learned a lot about this. And in fact, there are things that really make a difference. Yes, you have to take your medicines as prescribed. That's really important because you're not going to be able to control inflammation, especially in the early stages, unless you're taking your medicine exactly as your doctor has asked you to do it. But there are some other factors that make a difference too. And one of the things that we did initially was we looked at people who weren't getting into remission in the first year. Now, more than half of people will reach remission, but for those who aren't reaching remission, we were curious, is there something about them that might be a little bit different? And when we started to look more carefully, we realized that there were some lifestyle habits that were making a difference. For instance, weight seems to play a very important role. Patients who are obese are much less likely to be in remission at 12 months. That holds true for men and women. You have twice the odds of not reaching remission if you're a woman and you're obese, and it's even greater than that for men. What we also found is that smoking plays a role as well. And when you put obesity and smoking together, well, now you've got a situation where men are never going to hit remission in the first year, and women aren't even going to get out of moderate disease activity. So for women, the combination seems to be particularly problematic. We think this is really important because it signals to us why some people don't respond to treatments in the same way that we would expect them to. And it is something that for which there's some degree of control. I'm not saying that it's easy to stop smoking, nor is it easy to lose weight. And most people who are overweight or obese have tried to lose weight and have had varying levels of success. But what I can say to you is it really does make a difference. The drugs just seem to work better in people who have a lower body weight. And that's probably because, well, we know, for instance, that when you're overweight, you're carrying excess fat in your body. And that excess fat is more than just dead weight. What it really is an abundance of very metabolically active tissue. And so it's pumping out all kinds of hormones and chemicals into the body. And that's making it much harder for your drugs to work as well as we would like. So yes, in fact, these two lifestyle factors prove to be more important than any number of other factors, including the treatments that people were prescribed, whether or not they were RF or ACPA positive, their level of disability, even their level of symptoms around the time of diagnosis.